Increasing use of telephone consultations is the big thing that's changed over the last few years.
Love the phone system, recommend it all the time to my colleagues.
It would be not unusual for me to speak to a dozen or more patients by phone on a day. The most useful thing that we have is a headset. The headset means that I can keep my hands free to access the computer system, and it also means I don't get quite a sore neck as I used to.
We've got two main lines that come into the surgery. We call them appointments and inquiries. Patients dial a different number for each, but essentially get through to the same people. We
would not be able to run the urgent care service without the capability of moving different staff on and off the phone. So I think that's a vital component, and of course the Wallboards system gives you the information you need to allow you to know what to do with your staff. So I think those go hand in hand.
It enables whoever's managing reception to say we need more people on the phones, or actually we're not so busy today, perhaps someone could come off and do something else and use their time more wisely. Nearest me, that one, so sit yourself down and cuff on that way.
If we see that the queue's building up particularly more than usual, myself and my reception manager can pick up an extra phone so we can dial into those lines and actually help out with the volume of calls that are coming through, so patients aren't having to wait as long.
We could work without it, but it wouldn't be so effective. I mean, we can see when we've got calls waiting, we can see when we're really busy and we've got lots of people coming waiting, or even worse, people not being able to get through it all. So it definitely helps. Bye-bye. Bye.
We've got 13,000 patients and probably 4,000 of those are eligible for a flu jab. The cost of writing to all those patients would be enormous, so most people are aware that they need a flu jab that are in the at-risk groups, so this is just a gentle reminder. So they might be ringing to make an appointment for something else, but they hear this message and think, oh, actually I'll make an appointment for that while I'm on as well.
Okay Harry, now we're going to move on, and we've got 5 telephone slots now. So
the thing I love most about the system is that it records all the calls incoming and outgoing.
You can download the call straight onto your desktop, which obviously allows you to then email it to any person that you need to email it to, and that's also relatively straightforward because on the call recording software there's a save button which you can just generally save straight to your desktop.
There was a dispute over the urgency at which an appointment was requested, so the tape then was really important, because actually being able to discuss what was actually said in detail, factually recorded at the time, is a very powerful tool that one can use to have those discussions with someone who feels that their request has not been dealt with appropriately.
In complaints where it's been more complicated because it's over a series of conversations, we've been able to document not only what was said but exactly what times were called, then what was said to, for example, secondary care in between. If the doctor's rung a registrar at the hospital and got some advice, then what was relayed to the patient. So in terms of timeline, it's very good, as well as just what the content is.
Another circumstance that we have used the call recording that comes to mind is in staff training. So we give our staff a number of scripts to use, and that helps them manage patient demand and requests, and that can be useful to play those back and just see how those scripts work and whether they need improvement or not, and how they were understood.
Right, okay, so as soon as possible.
I think it really ends the debate, really, because it's absolutely factual. It's not a case of interpretation. That's what was said, and usually you move on quickly from there. It
is a very, very straightforward software. You don't have to be very technological in yourself to actually do it, but the software itself is actually got very, very high technology within it. But it literally, you could run it after maybe like 1 or 2 tries at it, just look over it, go over it, and then you should be sorted. It'll be fine, easy to run.
Very clever little tool that just will measure your oxygen saturation. Okay. And I'm sure it'll be fine.
I have to be very honest, I haven't compared the cost recently, for the simple reason, actually I don't want to go elsewhere. But one of the partners here has come from another practice, and when we signed a new contract recently, he was very involved in the financial side of it, and he said, well, yeah, we're getting a really good deal here.